In this video, we're going to be looking at embedded objects into a person and also amputations. Let's look at embedded objects. So depending on your hobbies, depending on your work, you might be higher risk of this happening. Maybe a nail has gone through somebody's hand or through their foot. But glass is a big one, and it's the one injury that is quite difficult and nasty. I've got this here just so that it aids me to show you how to do it. When it comes to glass or embedded objects, we have to think of icebergs, because what you see on the top isn't necessarily what is underneath. It could be superficial, it could be going down into the person's veins, ligaments, tendons and nerves. And if you were to just pull the item out, you could cause permanent damage. So if you ever do have to treat somebody with an embedded object, this is how you're going to do it. Ideally, you're going to have your gloves on, and inside your first aid kit, you will have bandages. Take 2 bandages. One, 2. You might need somebody to help you doing this, but we want to put one bandage at one side of the glass or nail and one at the other side. The reason why we're doing this is that we don't want the person to move it by accident or even on purpose, because we want to stabilise it to try and prevent any further damage. Once you have 2 bandages on, inside your first aid kit, you will have tape, micropore tape. If you don't have micropore tape, then you could just use a bandage to strap these 2 together. So take off some tape, and what you want to do is just go on and around. Make sure you're gentle though, because this will be extremely painful. As you can see, this isn't a real human. At the other side, just some more tape, just to keep it in place. And again, gently. This really does prevent it from moving and getting more damaged. Once you have done this, you must get further medical attention, depending on how the person is acting. If the person is extremely dizzy, they look as if they're just about to pass out, they might even start vomiting. You make sure that you sit them down and you call emergency services to come to you. If you have it controlled, if the person looks okay, they're acting okay, it might be a trip into A&E. As soon as they get to A&E, they will scan it. They'll probably do an X-ray just to see if it's actually hitting off anything, nerves, ligaments, tendons, muscles, and they may have to surgically remove it. Or it might be all positive news and they might just be able to remove it. Sew the person up, job done. So just to recap there, embedded objects never remove anything. You just don't know how deep it is. Another injury, especially in certain workplaces, if you're working with circular saws, heavy machinery, there is a potential that you could have or amputate a finger. It could be 2 fingers, 3 fingers, 4 fingers. You may just deglove. Football is a big one when we see degloving. Why? Wearing jewellery, and when people jump up, especially the goalkeeper to save, the rings can get hooked on the netting and it can pull the finger completely off, degloving. It might only be just a little part of the finger that's been cut off, but your treatment is going to be exactly the same. Now, of course, you're going to get the person sitting down. You want to make sure that they grab something tight. They need to get direct pressure onto that blood loss. You then need to look after the part of the finger. I'm going to use this lid of the pen. Imagine this was the part of the finger that got chopped off. Inside your first aid kit, you do have gloves. So you're going to use one of the gloves. We want to preserve the finger or the part of the finger to the best of our ability so that reattachment is a lot easier or possible. Using your glove, you're just going to pick up that part of the finger and turn it inside out. Gloves are really good because they're not fibrous, so you won't leave any fibres on and it's a lot easier to clean when they get to hospital. Now we need to look after this properly. We don't want to freeze it, but we want to keep it cool. Inside your first aid container, you will have a triangular bandage, or if you're at home, just use a tea towel. Make sure you wrap it in something protective, and then if you're at home, bag of frozen peas, or if you're at work and you've got instant ice packs, we just want to put the instant ice pack onto it. This then increases the chance of reattachment. Now for an amputation, it really depends on how the person is acting. If they're really dizzy, they look as if they're going to be throwing up and they don't know what time of day it is, you're going to keep them where you are and call 999 and let them come to you. If the person is okay though and they are able to walk, then it can be a trip to A&E. This is definitely not a trip down to the pharmacy. Reattachment is possible. Look after that person's finger, or even just the tip of the finger. Keep it, preserve it, and take it with them to hospital. I'm Sarah, owner and trainer of First Aid at Work, Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.